Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing balancing NPTE prep while undergoing your clinical rotations, especially how to not burn out in the process. So, first, let's talk about the importance of communication. Being able to communicate efficiently and effectively with your clinical instructor about your NPTE studies is really, really important. You want to be as transparent as possible because your clinical instructor can help you provide you with support, advice, and maybe some guidance along the way. It's also so important to be transparent so they understand any additional stressors or things that you're going through during your clinical rotation. Approach this conversation professionally and respectfully, because although you may be also trying to balance your clinical rotations and your NPTE studies, it's really important to make sure you're also being fully there and participating in your clinical rotations and not just trying to spend time studying as well. You need to make sure you're prioritizing both components, and your clinical instructor may be able to help you navigate through that difficult process.
I think it's very important to note when you do have that conversation, make sure you stress the importance of you understanding you being in that clinical rotation, that is your priority to be in that clinical rotation, that you plan to have your focus within that clinical rotation, and listen to your clinical instructor. Just like the saying, have your mouth closed, ears open, and just listen to their input, their feedback. And I think it could really go far and help you out a lot to have that transparency, because sometimes some of these clinical instructors, they haven't been with a student in such a long time. They haven't even been students in a long time. So they may have forgotten what their entire journey was like.
Yeah, with that
So
being said, too, I think, David, another really important point is it may be beneficial to explain to your instructor maybe why you're taking your exam during your clinical rotations. Maybe there's a specific reason, whether it's a job lined up, just financial responsibilities, if that's something you're comfortable with. Sometimes it's beneficial just to kind of give your clinical instructor an idea of why you're taking it during clinical rotations and not waiting to take it afterwards when programs offer, variety of options. But again, that's not necessarily something you have to disclose to your instructor, but if you're comfortable with it, it may not be a bad idea of something to add.
yeah, for sure. So let's say that the clinical instructor gives you approval, or maybe it's during your lunch break. You can get some micro studying sessions in there, and that's just short focus study sessions that you can do at any time. It could be 5 minutes or 10 minutes, just really quick, but to the point, and you're going to know exactly what you're going to focus on, because before you go into the clinical rotation that day, I want you to just write down on a piece of paper what you specifically want to focus on for that entire day. And then whatever you're going to review in that clinical rotation, take with you. Don't take your entire textbook or anything like that. If it's quick moments, quick bursts, bring things that are going to help you out. So maybe have information on your cell phone devices, if you're allowed to have cell phone devices near you. Maybe it's index cards that you're going to have. Maybe it's a few pieces of paper that you have folded up and stuffed into your pocket, where sometimes you just step away and you look really quick and then you get back to business. But I can't stress enough the importance of running it by your clinical instructor as well, especially if it's not during a lunch break. So, right, Emily?
Yeah, something else that's really beneficial, I think, that you can do to not only prepare for your board's exam, but also refine your skills and knowledge within the clinic is think about patient scenarios. Maybe you did an evaluation or you just performed a goniometric measurement. That could be a great thing to write down to review in more detail at lunch. Maybe review the differential diagnosis of that patient that you had. Maybe review your range of motion measurement, your goniometric landmarks and normative values. Think about the things you're doing in your clinic and maybe write those down and do quick recall on those during lunch or those breaks, because then it shows your clinical instructors that yes, you are prioritizing your time in the clinic and your patient care, but it's also a great way to also, study for the boards. So that's something else you could do as well within those micro studying bursts, especially if maybe there's some downtime within the clinic. That could be when you really emphasize that style of studying. Now, we're talking about studying, we're talking about your clinical rotations. It's busy. You are doing a lot. And it's really important. I know David and I have talked about this previously, is being mindful of burnout. And that's something that's very important, not just for your NPTE preparations and studies, but also for you as a clinician. So be mindful of when you're nearing signs of burnout and how to correct this early on to prevent it from manifesting. So be mindful of your fatigue. How many times have we talked about sleep, David? We have talked about sleep more times than I can count, right?
You would think that by this time, one of us on this podcast would actually get a proper sleep cycle, but who could that be?
So always being mindful of sleep to help to prevent fatigue. Be mindful of if you're becoming irritable, if you're not really motivated to look into your patient cases, to look into your study preparations. So be mindful of these and drops in your study effectiveness also. These can all be signs of burnout. So what are some ways to correct these signs of burnout? Take those short breaks, both mentally and physically. Set realistic goals, not just in the clinic, but also within your study preparations. Seek support from your peers, your mentors, or more specifically in this situation, maybe your CI, your clinical instructor, when you're reaching these signs of stress and burnout. And self-care. In addition to sleep, nutrition and exercise are very beneficial as well.
That's for sure. And at the end of the day, you all have to remember that it is a balance. It is not perfection. So go get this. You can do it. Now that you heard our podcast, here is a quote from Marcus Aurelius. You have power over your mind, not outside events. Realize this, and you will find strength. Find the strength to control your mind. Find the focus to control your mind. Find the action and go do it. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can visit all of our social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.